Good afternoon. Thank you so much for joining us here today. You are watching Ask Us Anything About Having a Baby Now. I'm Barbara Schiavo. Preparing for the birth of a baby can be very, very exciting, but also can be very overwhelming. A lot of things to think about, a lot of decisions to make. Joining us here today to talk about what to expect when you're expecting is Dr. Christina DeAngelis. She is an obstetrician gynecologist at Penn State Health, Milton S. Hershey Medical Center. Dr. DeAngelis, thank you so much for joining us today. And we welcome your questions for Dr. DeAngelis. If you have any questions about having a baby, getting ready to deliver a baby, please feel free to post your question in the comment field below the post, and we will ask Dr. DeAngelis to give an answer for you. So let's start off by kind of starting at the beginning. Let's say somebody is trying to get pregnant or just found out they're pregnant. What's the first thing they should do?
Well, many women who intend to get pregnant will come in for a yearly visit and mention that to their doctor. It's good to discuss it ideally before pregnancy even occurs, because we can give them some advice that will get them off to a good start from really the first day that they're pregnant. Mostly, we like to review with them any immunizations maybe that they would need to get prior to getting pregnant. Talk to them about any genetic conditions that could be present in the family, to perhaps put them in touch with a genetic counselor to see if it's something that could be an issue in a pregnancy, and also to remind them to take a vitamin. When you take a multivitamin, all multivitamins have folic acid, and very early in the pregnancy, from the time women are roughly 5 to 8 weeks in their pregnancy, if they have normal and healthy folic acid levels, it can prevent a birth defect where sometimes has issues with the spinal cord formation and result in spina bifida. So that's the ideal situation, and we're happy to talk to them about nutrition and exercise, which is to optimize before getting pregnant. However, if that's not the case, and women get the good news that they're pregnant, typically they'll call whatever physician's office they've been getting their OBGYN care through. And I'd say most offices would set them up for an appointment relatively early in the pregnancy, usually when they're around 8 weeks pregnant, to do an ultrasound to confirm that everything's healthy with the pregnancy, to come up with a definite due date so that they know when to expect to meet their baby. If they haven't had the opportunity to discuss taking vitamins and doing those types of preparatory things, they would review that at that point.
That is some very helpful advice, and good to know too. So it sounds like kind of the important things from the onset are going to be nutrition, immunizations, genetic counseling if necessary. So let's talk about, I'm sure that you might hear this kind of question from a lot of expectant moms as they're kind of going through pregnancy and getting ready for delivery. Do you give them kind of a checklist? How can they be sure they're doing everything they can to best prepare?
So again, most OB offices have essentially exactly what you're talking about, kind of a checklist each trimester, topics that we like to discuss with them for their education, to prepare for childbirth, or to prepare for the needs that they would have for their baby. The first trimester, I would say most of the focus is just getting them through that first trimester, because for some women, the first trimester is really tough. Some women unfortunately experience a lot of nausea and vomiting, and their energy level usually isn't fantastic, and they're not always sleeping well. So more of the focus, I would say, in the first trimester is on the mother, just getting her to feel better and making sure everything's off to a good start. In the second trimester, I'd say, we start providing some education related to the baby. We talk about childbirth classes. They're ideal to do either towards the end of the second trimester or the beginning of the third trimester. So it's kind of fresh in your mind, that information. We talk to them about immunizations that they should get in pregnancy, specifically the pertussis vaccine. Pertussis can be very serious if a newborn gets the whooping cough, or pertussis as we call it, and the newborn can't be immunized until they're several months old. So we recommend getting the mother re-immunized at the end of her second trimester or the beginning of the third trimester, so she can pass on those antibodies to her baby. We talk to them again about nutrition. We screen them for diabetes and pregnancy at the end of the second trimester. And then in the third trimester, we really start to focus more on, again, preparing for the birth, talking to our patients maybe about a birth plan if they're interested in a birth plan, talking to someone to care for the baby. A lot of times when we're pregnant, we're just really excited about the pregnancy, and, we take care of mother and baby when the baby's in the uterus. However, once the baby delivers, I always tell patients, the only thing I know about baby care is what I know from myself as a parent, and I'm far from a person. So we talk to them about finding either a family medicine doctor or a pediatrician to continue care for their baby.
So it's important to be thinking about what they need during the pregnancy, but also thinking about what are you and baby going to need after delivery.
Absolutely.
So you're watching Ask Us Anything About Having a Baby Now with Dr. Christina DeAngelis, obstetrician gynecologist at Penn State Health, Milton S. Hershey Medical Center. So something you had mentioned was talking, with expectant moms about birth plans, and for a lot of women that includes delivery in a hospital. So I'm sure it's a very important decision about where am I going to have my baby. What do women need to think about when they're making that decision?
I would say that probably the majority of women do have babies in a hospital or in a birth center for several reasons. I think most women have a little more comfort knowing that there's more than just a midwife or a physician there with them. They would have all the resources that a birth center or hospital could offer. In a hospital like Hershey, we have a NICU, and no one ever wants their baby to go to the NICU, but unfortunately, sometimes you can't predict a complication that could occur at birth. So I would say we don't have a lot of patients in this region who plan on home births. Some patients who are in the Amish community, plan for it, and other patients may. It can also be, unfortunately, an insurance issue. Most insurance companies will not pay for home births, so that can be a factor as well. I think it's good to be at the place that you feel most comfortable in to have your baby. And again, as an obstetrician, I'm always seeing unusual things and sometimes the worst things. So of course for myself, I would recommend being in a facility where you would have resources like NICU and pediatricians available if there's any unexpected complications.
Yes, I'm glad that you brought up the unexpected complications. I mean, I don't know from personal experience, but I know a lot of girlfriends who have, something has happened and not necessarily good or bad, but something unexpected happens the day of delivery. So it's a good idea for a lot of women to be in a facility like Penn State Children's Hospital. Can you talk a little bit about, what is it that we may offer at Penn State that can help for those kind of unexpected things that might happen on delivery day?
So there's a few resources we have at Penn State that I think allow for a very safe birth experience almost no matter what happens. First is that we have anesthesia providers available 24 hours a day, 7 days a week. That's very important because if you need to do an urgent type of C-section, we have them available so they can provide anesthesia so that we can safely and quickly deliver a baby if it's necessary. It's also important because there may be patients who have had a C-section before, and the second time around they want to try for a vaginal delivery. It's only recommended that women do so in a facility where there is the availability to do an urgent C-section essentially immediately if necessary. So you need 24-hour, 7-day-a-week anesthesia providers in the hospital available urgently. The other issue that I mentioned would be the NICU. Again, most babies, thank God, are born in transition very easily, but some babies, for whatever reason, do not make a smooth transition or not breathing easily on their own. And we're grateful to have such a great NICU team that are able to be there immediately to assess the baby, to provide any respiratory support, to help the baby's lungs transition, or if the baby had an issue with their heart that it was unaware of before birth, they're also available.
So that must be very comforting for moms who are delivering, at Penn State Health, Milton S. Hershey Medical Center, Penn State Children's Hospital, to know that there's all these resources there to make sure that, everything will be safe and comfortable, should something unexpected happen during delivery. But speaking of delivery, so you yourself and you're ready for baby and it's time to deliver, time to go to the hospital. What kinds of things should women or families be thinking, I should have this in my go bag, if you will? What should they bring with them to the hospital?
Yeah, that's a great question. That's something I like to review with my patients again in the third trimester. I usually encourage them to start putting a bag together around 36 weeks. So when they come into the hospital, a lot of supplies will be provided for both the mother, their support person, and the baby. Essentially for their baby, really the only thing that they need to bring in is an outfit to go home in. And if they choose to have pictures of their baby, usually they'll dress them in their cute outfit, take the pictures, and then they can go home. And a car seat for the baby. But really, all the baby's supplies are otherwise provided. Baby wash, diapers, onesies, all of that's provided. For the mother, I always encourage women just to wear the not very attractive, but relatively functional and comfortable hospital gown while they're laboring. I have had some patients order like on Amazon or through maternity websites these really cute gowns to labor in. They do look really nice. I just personally didn't really matter to me. But I do encourage them to wear something comfortable to wear after delivery. I usually encourage them to like treat themselves to a new pair of pajamas, maybe one size bigger than they would wear if they weren't. Probably don't need to be as big as what they were wearing at the end of the pregnancy. Nursing bras can be nice, or like a supportive cami to wear. Flip-flops just to wear around the room can be nice. The one thing that all hospitals have that is not fabulous are the pillows, because again, we care about sterility. We have plastic pillows that have like no support to them. They have to be plastic so we can wipe them down, sanitize them. So
Sure.
I like a good pillow. My neck sometimes hurts, so I'll tell them, maybe bring in one of your pillows from home for you and your support person. An old pillowcase, because labor can be a messy process, So I'm like, you don't want to place this pillowcase on it, but bring some pillows in. A lot of patients like to bring like an iPad in. We have Wi-Fi in the hospital that patients can connect to for free. So it's a nice opportunity for them to show off their baby, family and friends. I usually encourage them to bring like a fun magazine or a book in, because babies are not on a schedule at all at first. There's a good chance they're going to be up at like 3 o'clock in the morning where there's literally nothing to watch on TV. So, it's a good time to catch up on your celebrity gossip with like a People magazine, something along those lines. Any of their toiletry stuff, their toothbrush and, shampoo, any of that stuff is good. But all their meals will be provided, Motrin, Tylenol, anything for aches and pains that's provided. Pads, after giving birth, women are going to have bleeding for a while. And so we have, industrial size pads for our moms to use. We also have these mesh underwear. They're not very pretty, but they're very functional and they get the job done. So that's provided. And they're really just an outfit to go home in.
Mm-hmm. I was just going to say, I'm sure that a lot of, if it were me, what I'd be thinking of is probably that after baby photo op. Like, I want my cute outfit to go home in and a cute outfit. But that's good. Bring your comfy clothes, a pillow, a couple extra things that you might want. I'm sure that's very helpful for new moms to know. Sorry, again, you are watching Ask Us Anything About Having a Baby Now with Dr. Christina DeAngelis at Penn State Health, Milton S. Hershey Medical Center. If you are expecting or soon to be expecting, if you have any questions about, what to expect when you're going to be having a baby, please feel free to post your questions in the comment field below this post, whether you're watching this live or watching on playback, and we will get an answer for you. So Dr. DeAngelis, let's talk about, right now is, we hear this phrase over and over again as we're kind of living in a new normal now, with the COVID-19 pandemic, and that may cause a lot of anxiety for women that are going to deliver, having to deliver during a pandemic. So can you talk a little bit about, what are we doing to ensure the safety of all, moms and babies for those that are delivering babies during the pandemic?
Yeah, that's a great question. And I do feel bad. I think this is a very stressful time for everyone, but especially for families that are expecting a baby. Obviously, they want their baby to be healthy, and they're understandably concerned about getting an infection around the time they deliver. So I think Penn State has done a very good job at balancing, making it a nice birth experience for our patients, while doing our best to minimize or reduce the risk of exposure to COVID-19. So from the time that really things shut down in March, we always were very grateful that we were able to allow our obstetrical patients to have a support person with them. As some people who are watching this might be aware, there are regions in the country, particularly New York City and some other areas, where it was just so bad at the time that women were laboring alone. They weren't even allowed to have a support person. We were never in that situation. We do minimize it to one support person. So that has to be the same support person. In other words, you can't have like your mom one day and then your partner the next day and grandmom the next day. It's the same person with you the whole time. We do screen all of our obstetrical patients either before they come into the hospital. So if it's a situation where a woman knows she's going to have a C-section on a certain day, or if she's going to have labor induced on a certain day, we have her go a few days before she comes into the hospital for COVID testing. And we encourage her to try and quarantine herself after she has the test done until she comes into the hospital. If a woman just comes in labor, then we test her as soon as she arrives. And we have the ability at Penn State Hershey to do in-house rapid testing. So we get those results back typically within 2 hours. We don't test their support person, but the idea is that they're almost like a cohort. Typically, that's the person they've been living with. So one would expect that if the patient herself was negative, probably her partner would be negative as well. So I think that helps a lot. We've tried to limit traffic coming in and out of the hospital. It's only been more recently that we've allowed other hospital patients to have a support person with them. And again, it's only just one person that they can have, and the same person. Of course, around the hospital, all of the staff, when we're in a situation where there's other people with them, we're all wearing masks 100% of the time. So I think all of these measures help. We've always had very good sterility. That's never been a problem here at the institution. So I'd say the difference is trying to limit flow in and out of the hospital, doing the COVID testing and wearing the masks.
Mm-hmm. And I'm sure too that the goal of you guys and the families is to still give everybody, the best birth experience they can have, even though it's a little bit different. Some things are changed, and they got to do a couple extra steps, but you're still committed to making sure all your moms and families have a good experience.
Yeah, we've received a lot of nice feedback. Again, the care we provide to our patients is very important to us. It is our goal every day to make it the best experience. I always say there should be nothing happier than welcoming your child. So we give surveys to our patients who have been here to have their baby or to have any type of obstetrical or GYN care. And we look at those very carefully, and we do feel very fortunate that we've gotten a lot of very positive comments from our patients. So, I think that's a good testament to the fact that we're doing our best to make it a good experience. The patients appreciate that.
Mm-hmm. Oh yeah, I'm sure they very much appreciate the commitment on your end. So something a little exciting to talk about here is that there's going to be a new labor and delivery unit, in the coming months with the expansion of Penn State Children's Hospital. Can you talk a little bit about what's going to be new in that unit and what's exciting about it?
Yeah, so it almost makes me want to have a third child, Barbara. I'm 8 years old. That's not going to happen. It's very nice. So the idea is that it's kind of like a mother-child unit / building. We have our children's hospital, which is it's the newest facility here at Penn State. And so it's ideal to have all mom, baby, child issues in the same vicinity. And that hospital, when it was built, it always had the capability to add on top. So the 6th floor is going to be our new labor and delivery unit, and the 7th floor will be the new NICU. So they'll literally just be one floor above us. They can easily, run down the stairs or take the elevator down if they need a care transporter for a baby. But they're very nice. They're all private rooms, which, we have now, but they're brand new. They have the newest technology in them, the newest monitors. I haven't seen the final decorations because it's due to be completed in November, but all the colors I'd seen, the artwork, it looks very nice. It's a very welcoming place, the lounge is very nice and very comfortable for families to wait in. So it's really going to be very, very nice.
It sounds like it's going to be very exciting, very as you said, state of the art, new equipment, beautiful new portions of the building, and we're all very excited about it. I think for me, I think you saying it makes you want to have another kid is probably the highest praise you could give it.
Yeah. The other thing that I'll just mention too that's unique is the new NICU, which is the neonatal intensive care unit. Almost all of the rooms for the babies are private rooms with a bed for parents to stay and room in with their child. That's very unique. Traditionally, all NICU units were what we called open units, where essentially it was one big room and they had bassinets for the babies that would, go down in a row. So this is unique. I don't think there are many institutions in the country that have this, but the idea is that if you have a child who's born preterm, say the mother's only 28 weeks, that baby is going to be in the NICU until close to when she would have been full term. It could be several months. And particularly for families who live far away, it's great to have that option to stay there with their baby. So that's, I think, a very unique feature of our new NICU. I was jealous. I looked at those rooms. I'm like, oh my gosh.
Not only
room at home.
Not only does it make you want to have another baby, it makes you maybe want to have twins or triplets. So that
right. Well, it's interesting. They have the only rooms that they have where there's more than one baby is they have a room for 1 or 2 rooms for twins and 1 for triplets, and they all room together, but they still have a bed for the parents to stay.
That sounds great. It sounds very accommodating, and we're very excited to see it. And as you said, that will be fall that will be open. So
Yes.
About November. So we will wrap up here in just a moment, but I just wanted to point out too that you went over a lot of information during this Ask Anything about having a baby, but there's still probably plenty of things I didn't touch on. But we do have some resources for women who are interested in learning more. Right? There's an upcoming virtual event. And I believe that's called What to Expect When You're Expecting on September 16th. Can you talk a little bit about what that event's like and how people might join?
Sure, I'd be happy to. So we started this opportunity for patients to learn a little bit more about Penn State and the care providers who will be with them during their labor and delivery and postpartum period. We started it last September. Now, clearly what's changed between then and now is COVID. So we had a few sessions. We used to do them in our auditorium at the hospital. Patients could come in with however many people they wanted. We did a tour. COVID obviously changed that. Our June session we did as a Zoom webinar, and that's what we're set up for next week. So in a sense, it's nice actually because again, it saves people commuting to the hospital, getting parking. They still get all the same information, or if they're late home from work, they can just sign in, when they're able to. So what we like to do is just to give an overview to patients, particularly if it's your first baby. I think it can be a little intimidating just not knowing how things are going to happen. So we go over with them even basic information. Okay, when you call in and you think you're in labor, where are you going to park? Where are you going to get into the hospital at 2 a.m.? Particularly the support people, they view it, that's their job. They got to get you there. So they're very appreciative of that information. Then we explain to them, when you come up to labor and delivery, how do we monitor you during the labor? What kind of equipment would we use? How long does it take for the average labor to go from starting labor to when you deliver? How many days will you be in the hospital? What kind of care and support will you be given? We talk about the lactation consultants who come around every day and offer our patients encouragement and help with breastfeeding. Our midwives talk a little bit about how they can participate in the patient's care. A lot of people view Penn State Hershey as a place to go if you have a very complicated pregnancy. We have a lot of very healthy, low-risk patients. Many of them appreciate the care they can get from our midwives who are outstanding, very experienced individuals. So they talk about what they can offer. Our family docs, a few of them provide obstetrical care. So they talk about what it's like to have OB care from a family and community medicine doctor. We talk about circumcision for patients that might have a male infant. That procedure is done, what to expect, and then a little bit about the care for the baby afterwards, when they're going to follow up with the pediatrician. And then one of our neonatologists gives a brief overview and talks to patients about what it's like if their baby's in the NICU, how often they can get updates, when they can go visit the baby. So I'd say it's a really nice overview of pretty much anything that can happen once they're in the hospital. And it's free, and we love to have as many people participate as they want. One of our anesthesiologists also talks to them about the anesthesia they can provide. And we like to give our email information. So again, if patients have follow-up questions, they can email us, and we're very happy to respond.
Well, that sounds like a really nice, informative, encapsulating session, and that's something that any expectant mom or family that's looking to have babies or even thinking about having babies and wondering what it's like to do so at Penn State. That sounds very helpful. And again, the date on that is going to be Wednesday, September 16th, 6 o'clock in the evening, and we will post a link to that event. We'll post some more information in the comment field below this post here. So if you are watching this and you're interested in that event and learning more, you can find information in the comment field. And as far as ask us anything about having a baby, if you are watching this on playback and you have another question that Dr. DeAngelis has not answered here, please feel free to post that in the comment field, and we will make sure to get an answer for you, even if you are watching this on playback. But for those of you watching live, thank you so much for joining us. Dr. DeAngelis, thank you very much for your time. This has been very informative and a fun conversation, so thank you.
Thank you, Barbara.